It's interesting how much gratification people working in palliative care report across disciplines. And often you'll hear people say, this is why I went to medical school. I went to medical school to really help people. I went to medical school to try to identify and address suffering of my fellow human beings. And there's this great sense of relief. Oh, yes, this is what brought me here in the first place. One of our graduates said to us after she finished her palliative care rotation as a geriatrics fellow, she said, finally, now I feel like a good doctor because of the skill set that palliative care brought her, the ability to listen, the ability to identify suffering, the ability to effectively and expertly react to suffering, the ability to meet the needs of patients and families across settings. I think if you look at how people are, the pressures that health professionals are under to see more patients in less time, to do throughput, to get as many people operated on, intervened on, imaged, tested, seen by consultants as possible, it's not a surprise that people feel they literally are not permitted to sit down and have a real conversation in human scale time, which means you can't do it in 5 minutes. So we walk into that space because that responsibility does not belong to anyone else in the hospital. So we stepped up as a field and said, we'll take that responsibility. And what's so gratifying about that is that hospitals are recognizing that that's a gap that needs to be filled.